Here's a USMLE style question focused on transseptal left atrial catheterization. USMLE question on transseptal left atrial catheterization. A 55-year-old woman with a history of atrial fibrillation and chronic heart failure is being evaluated for possible left atrial appendage (LAA) closure. During the procedure, a transseptal puncture is performed to allow access to the left atrium. The cardiologist advances a catheter through the interatrial septum into the left atrium to guide the procedure. Question: which of the following is the most important step to ensure safety during transseptal left atrial catheterization? Option A: administering systemic anticoagulation to prevent thromboembolic events. Option B: confirming the location of the catheter tip in the right atrium before puncturing the septum. Option C: monitoring for signs of pericardial tamponade during the procedure. Option D: using fluoroscopy to guide the transseptal puncture and catheter placement. Option E: performing a coronary angiogram to evaluate for coronary artery disease. The correct answer is option D: using fluoroscopy to guide the transseptal puncture and catheter placement. Explanation: transseptal left atrial catheterization involves passing a catheter through the interatrial septum to access the left atrium. This procedure is commonly used for interventions such as left atrial appendage (LAA) closure, atrial fibrillation ablation, or assessing left-sided heart pressures. Option D, fluoroscopy, is essential to guide the transseptal puncture and catheter advancement. It helps the operator visualize the catheter's location, minimize risks, and ensure precise puncture of the interatrial septum. The combination of fluoroscopy and echocardiography provides real-time guidance during the procedure. Option A: anticoagulation is crucial before and after the procedure, especially if the patient has a history of atrial fibrillation to minimize thromboembolic risks. However, it is not the most critical immediate step during the puncture. Option B: ensuring that the catheter tip is correctly positioned in the right atrium before puncturing the septum is important, but fluoroscopy simultaneously confirms the proper placement of the catheter and the transseptal puncture. Option C: pericardial tamponade is a potential complication, and its signs must be monitored, but this is more of a concern after the puncture and catheter placement rather than during the initial procedure. Option E: coronary angiography is not routinely performed during transseptal catheterization unless there is a suspicion of concurrent coronary artery disease, which is not the primary concern for the procedure at hand. In summary, fluoroscopy is the most important tool to guide the transseptal puncture and placement of the catheter safely, minimizing risks such as perforation or incorrect placement. Thank you for listening.